And today I just want to talk about ABG. Just want to make it easy for you. I think you're ready. So as you can see from the title, just want to summarize. I know there's so many techniques, but I think if you understand exactly what is going on, you don't have to think about it. You just like see it and then make deduction and see what exactly going on in terms of acid-base status. And so I'm going to give you the most important things you need to know to answer these kind of questions. You got to know certain basics about ABG. Of course, you have to know these numbers, these normal values that they usually give you, and the pH, and this is the range. Okay, and then for your exams, you don't need to know the PaCO₂. It's not that important. They want you to be able to identify the PaCO₂, the range 335 to 45, and a bicarb. This one, that one, and this is what you need to calculate. They will give you the PaCO₂ and a SAT. It's unnecessary. It doesn't tell you what kind of acid-base status the patient is in. For the calculation to figure out what is going on, use 7.4 initially. So I tried to use 7.4 initially. Then the bicarb, no, the CO2, turn it to 40 instead of 35 to 45. Later on, then you can change it back. Initially, and then bicarb, 24. So we're going to work with this numbers, 24 for bicarb, 40, and 75. And then we can figure out the acid first, then we can change it back into the normal. So you got to know these normal values first, but then when you're working initially, do the average, 7.4, 40. In order to understand acid-base status, you have to understand the definition of acute respiratory failure. The reason why we're doing ABG is to find out where is the patient status. And there's certain numbers when we get, we know that this patient is in respiratory failure. Then you have to know this so that you know how bad your patient is, whether it's for your NCLEX or while you're on the floor. When you get the ABG, you say, this patient is not doing well. We got to intubate the patient. Anybody who have a PaCO₂, that means oxygen in their blood is less than 60, it's not good. If their CO2 is greater than 50, it's not good. And if their pH is less than 7.3, and it's not good. This is the definition of acute respiratory failure. So when you look at the ABG, you say, you're dying. Your pH is too low, your CO2 is too high, and your PaCO₂ is too low. This is acute respiratory failure. This is for knowledge share so that you can understand why the importance of ABG. This is why we get the ABG to know exactly the individual respiratory status. And this, when we look at it, we have to make changes to the ventilator to make sure patient is ventilating and is oxygenating. This is telling me that there is no ventilation and there is no oxygenation at all. So that's acute respiratory failure. Now, let's get to the meat of everything while we're here. You have to know these formulas. So pH is a combination of the CO2 and bicarb. And this is what is going to help you. The pH, the CO2 is the respiratory aspect of it. So this is where your lung play a role. And the bicarb is the metabolic. So this is the kidney. So the lung and the kidney fighting to maintain your pH, hemostasis. Your body is in hemostasis. Your pH, like I told you, the neutral pH is 7.4. The CO2 we're going to work with is 40. And the bicarb is 24. So when any change to bicarb is a metabolic problem. Any change to CO2 is a respiratory problem. So these can go up and down. a name change. It can be respiratory acidosis, alkalosis, or metabolic acidosis or alkalosis. Right now, just don't worry about them. Just worry that a change in bicarb make me metabolic. A change in CO2 make me respiratory. And so this and that join together to give you the pH. And then we are going to use it to answer our question. Before we start, I just want to make some quick points. You have to know these basics so that you know. Acidosis means the CO2. Your acidosis can happen here and here. So in your lungs, acidosis means you're keeping more CO2. So high, it's greater than 40. Your kidney, when it's doing acidosis, is getting rid of your bicarb. So you got to know these things. These are the key points. Alkalosis means your lung said, I don't want CO2. I'm blowing out. So somebody is hyperventilating. Alkalosis means your kidney said, oh, let me keep more bicarb. These are the bases. So we're going to use this and that to answer the question. Now, this is the way it flows. The way I want you to think about acid base. So we have acidosis here. You start with acidosis. And we know our pH, this one is 7.4. Anything that is less than 7.4, even 7.3999, is still less than 7.4. That's why I want you initially use single number, 7.4. So if it's less than 7.4, it's acidosis. Then, as we said, what is acidosis? Well, it's either I go up on my CO2 or I go down on my what? Bicarb, step one. And what is bicarb? Bicarb is what? Metabolic. CO2 is what? Respiratory problem. And since this is what? We're dealing with acidosis, we just put it here. Respiratory acidosis. So this is what it looked like. We're dealing with acidosis. We have what? Metabolic acidosis. That's all. That means our bicarb is less than the 24, and our CO2 is greater than 40. That's all. So respiratory, because this is high acidosis, this is low metabolic acidosis. Then when you solve that area, then you got to go to compensation. This is where it gets some people. Compensation. You cannot leave the answer there. And the easiest way you should think about is if you have a respiratory problem, you fix it with metabolic problem. If you have metabolic problem, you fix it with respiratory problem. So what problem we have? We have respiratory acidosis. So this respiratory become what? Metabolic. And what? We have acidosis, it should be opposite. It should be what? Alkalosis. You just flip them. That is the easiest way. Respiratory acidosis, I said, okay, what is respiratory? Metabolic, okay? What is the opposite to acidosis? Alkalosis. And so this is what you need to do. The compensation for respiratory acidosis is metabolic alkalosis. That means clinically, this is what it means. If they give you a clinical scenario, if you're not breathing, like asthma patient, they're not breathing and they're building up of CO2, the kidney said, no, I need to hold on to bicarb. So they increase their bicarbonate and they create metabolic alkalosis in order for the body to be in homeostasis. The same thing. We have metabolic acidosis, right? Metabolic become what? Opposite of metabolic is what? Respiratory. Opposite of alkalosis is what? Acidosis. So we have respiratory acidosis. So they will ask you, what will you do with this lab value you've got. Do you let the patient breathe faster or slow down? This one, patient has metabolic acidosis, right? To correct it, you want the patient to have respiratory alkalosis. So you let them blow their CO2. They keep on increase their respiratory rate so that they can blow everything up. This is the key for acid-base status. If you understand this, you don't have to think about, you draw a table and say, this go up, this go down. You're losing the clinical aspect of the problem. So let's do the same thing for alkalosis. We know this is our respiratory, and we know this is our metabolic. Alkalosis means there's two things. It means I have more of this and I have less of CO2. I'm blowing up. Okay. Now, we already know that this is metabolic. Bicarb is metabolic, and this is alkalosis. So this becomes metabolic. You just put in words there. I'm just describing alkalosis. I know CO2 is always respiratory, whether it's down or high. I don't care. CO2 is respiratory, right? And it's alkalosis because it's down. So respiratory alkalosis. Now I have to correct it. How do I correct it? Opposite. I have metabolic. It should be respiratory. I have alkalosis. It should be acidosis. I have respiratory. It should be metabolic. I have alkalosis. It should be respiratory. So this is my compensation for this problem. Therefore, if I have to manage this patient who has metabolic alkalosis, I should do something that will lead to respiratory acidosis. The opposite is this, and that is the clinical aspect of that. So we're going to use it to do a question, and you see what I mean by that. So we have this. They've given us this example. Okay, our pH we know is supposed to be 7.4, and so this is here. And our bicarb CO2 is 40, bicarb is supposed to be 24. This, right? The 7.5 is greater than 7.4. Anything greater is acidosis, alkalosis. Anything less is acidosis. Therefore, since it's greater than that, this is your first stage. I will do, because this is 7.5, this is alkalosis. I don't know what kind of alkalosis is that. Okay? I know this is respiratory and this is metabolic. Okay? So then I go back and I said, okay, this 40, 40, I have my normal 40, and then this is 34 and 24. Therefore, this is the culprit. Okay? This is the culprit. This is the culprit. So if this has gone up, now it's 34 greater than 24. Therefore, since it's a metabolic problem, I'll put metabolic here. That's all. I don't have to think. Bicarb is always metabolic. I don't have to think whether it's respiratory. It's a metabolic. So now I have what? Metabolic alkalosis. Then you do your compensation. You're not done. Don't select the answer. If you have metabolic alkalosis, you draw it. What does metabolic become? Respiratory. What is alkalosis become? Acidosis. And we all know what gives you respiratory, CO2. And what is acidosis for CO2? Up. Is still 40. Therefore, it's not compensated. So we have metabolic alkalosis uncompensated. So this is uncompensated lab work. That is how you analyze it. There's no rush. You break it down because this will be passing level question. They're going to give you the patient's symptoms. They're going to give you numbers and they ask you, what do you do? So if they ask you, what do you do? The initial problem is what? Metabolic alkalosis. What do you do? Do respiratory acidosis. That means what? Slow down the patient rate on the ventilator, or they should take less breath. So that's what you tell them. Don't be hyperventilating. Slow down your rate. If your respiratory rate is 40, I want you to bring it down to 35 so that we can build more CO2 and take care of you. That is the essence of ABG. We're not getting in because we're getting labs, but we're getting in so that we can make changes to patient ventilation so that we can make them hemostatic in terms of their pH. So that is application. It will be a passing level question. To me, if I'm the examiner, that's the way I'm going to make it. So the same thing, number 2. Let's see if we got it. We write our pH 7.4 under, we write our 40, and we write our 24. Then we say this is greater than that. Therefore, if it's greater than 7.4, it's alkalotic. So that's your first step. If you get this, you're almost done. Then you ask yourself, if you're alkalotic, well, there's 2 things that should happen, okay? Alkalotic means you have to blow your CO2, or you got to keep more of your bicarb, okay? What has happened? Look at it, what has happened? The bicarb now is 24. It's not increase it. It's just by 1. It has not done anything. It's within normal range. The normal range is 22. This is where you go back to the range, 22 to 26. Look how this has blown up. So this has increased to 40. I mean, from 40, it has decreased to 31, which is below the normal range, 35 to 40. But you don't even have to go there. You can see that you have this has gone down, and that is what is contributing to the respiratory. And since this is the CO2, it's a respiratory problem, I put it respiratory alkalosis. Then I said, my compensation is supposed to be what? I have a respiratory problem, I get metabolic problem. If I have alkalosis, I should have what? Acidosis. So I should have metabolic acidosis. What gives me metabolic? Bicarb. What does that mean, acidosis? I should chew bicarb. Bicarb should go down. It's still 25. It's in the normal range. So this means we have respiratory alkalosis is uncompensated. It's not being compensated. So respiratory alkalosis uncompensated. So that's what it means. Let's try another one. Same strategy. Okay, same strategy. pH 7.4 here. We have our 40 and our 24. This is way lower than that. If you're lower than 7.4, you are acid. So I'm halfway. If I'm acid, what I mean is acid means bicarb, no, the CO2 should go up and bicarb should go down, right? Bicarb should go down. So that's what I expect, okay? So then I said, okay, what has happened? CO2, okay, CO2 went down, okay, and bicarb also went down, right? That means this is not an acid. We expect CO2 for an acid, acidosis, CO2 should go up and bicarb should go down. Bicarb went down. Therefore, the one doing the problem is this one, bicarb. But what is bicarb? It's metabolic problem. Therefore, this becomes metabolic acidosis. Now, then I said to compensate, well, if I'm going to compensate, metabolic means I have to do a respiratory problem. Acidosis means I have to do alkalotic problem. And what is acidosis, respiratory? CO2. And what is alkalotic? Lower CO2, right? And look at what is CO2. It has gone down to 23. It has done its job. That means it's compensated. But you said, oh, no, it's not completely because the pH is still not 7.4. So this is a cool one. Intentionally do that one. So metabolic, now you go back, you said we have metabolic, this is our problem. Metabolic acidosis, that's the initial problem. And what have we done? We've compensated with respiratory alkalosis, but we've not get to a pH of 7. So partial compensation. Metabolic acidosis partially compensated, and that's the key for that. It get easy the more you do it. You see that, oh, this is not hard. Same thing, RAM 4. We write our 7.4, we write our 40, and we write our 24. Then you look at this, you said this is way down, right? Therefore, it's an acid. You almost halfway. An acid, what do I expect? I expect CO2 to go up and a bicarb to go down. That's what an acid is. And what has happened? CO2 went up, bicarb stayed the same. So this is my boy causing the problem. What is CO2 represent? Respiratory. So I put it there, respiratory. I'm done. Then you go for compensation. If I have respiratory, I should have metabolic problem. If I have acidosis, I should have alkalosis. So metabolic means bicarb. From the initial, this information I give you is bicarb. Alkalosis means it should go what? Up. It has not gone up. It's still the same. So this is, then we go back to this. We say respiratory acidosis uncompensated. We have not compensated it. So that's it. Let's keep on going. 7.4, 40, and 24. 7.3 is lower than 7.4. Therefore, this is what? Acidosis. What is acidosis? High CO2 and low bicarb. Then you check what has happened. CO2 is high, perfect. What is bicarb? Bicarb went up, so this cannot be acid. Therefore, what was causing the problem? This boy. And what is CO2 represent? Respiratory. Then you put it here. So respiratory acidosis. You have your problem. Then you're not done because your test, you got to see if there's compensation. What is compensation? Respiratory means opposite of that is metabolic. What is acidosis? Is alkalosis. So I need metabolic alkalosis. So what is metabolic? Metabolic, who is always metabolic? Bicarb. Okay. What is alkalosis? It should go up. It went up almost by 5 points. That means he did some job work. Okay. He did what he's supposed to do. It went up, but the pH is still not normal. It's 7.3, close to 7.4. So this is compensated, but it's partially compensated. It did not compensate. It did not go up the much to compensate to bring this to 7.4. So this is respiratory acidosis partially compensated. This is another one. This is why I want you to use the 7.4 initially. You see 7.39. Somebody would think, oh, this is normal. It's not normal. Otherwise, you won't be able to get the answer. It's still less than 7.4. Even if it's 7.399999, it's still less than 7.4. So that's why you have to use 7.4 initially and 40 and 25 to do instead of the range. So this is less than 7.4. So we have what? Acidosis problem. It's still an acidosis. It's still an acidosis. Acidosis, what do I expect? I expect the CO2 to go up and bicarb to go down. What happened? CO2 rather went down. Therefore, this is not the problem. Bicarb went down. So this is my problem. This is what is causing the problem. And why? And what is bicarb? It's metabolic. So I have metabolic acidosis. Then you ask yourself, how do I compensate? You have metabolic, I'll get respiratory. If I have acidosis, I get what? Alkalosis. Now, then you look, what is respiratory? It should be CO2. What is alkalosis? It should go down. Did it go down? Yes, from 40 to 27. So this is a good one. You see, it's almost there, 7.39. Therefore, the answer is metabolic acidosis. This is not your answer. This is just the compensation. Metabolic acidosis. So don't just get confused. When the compensation is not your answer, it's a secondary problem. So we have metabolic acidosis fully compensated. It has brought the pH close to normal, fully compensated. We have compensated exactly using this method. 7. 7.4, you write your 7.4, you write your 40, and you write 24. This is still low. You see, this is why you can't use the 7.35 because this will tell you it's normal. In order to find what is the problem, this is still less than 7.4. So this is still an acidotic problem. It's an acidosis. So therefore, then you said, what causes acidosis? CO2 go up, bicarb go down. What happened to CO2 here? It went up. What happened to bicarb? It went up. Therefore, this is not my problem. This is causing the problem. And what is CO2? It's a respiratory problem. So this is a respiratory acidosis. So now, then you said, I've find the problem, respiratory acidosis. I got to compensate. I have respiratory, I have metabolic, opposite. I have acidosis, I should have alkalosis. What is metabolic? Who is causing the metabolic? Is always bicarb. What is alkalosis? Bicarb should go up. What did bicarb do? It went up. It went up, right? Bicarb went up almost like 14. And he brought the pH close to 7.4. Therefore, you go back to your normal and you say bicarb did what he's supposed to do. Everybody did what he's supposed to do. Respiratory acidosis fully compensated. And I will explain to you clinically. Patient is not breathing well, like asthmatic patient is in respiratory distress, is hypoventilating. Look at his CO2 is 70. I told you respiratory failure is pH and CO2 greater than 50. So it's in respiratory failure. The kidney said, no, I got to help. So the kidney start holding on to bicarb, or they give the patient bicarb. And that brought the pH to 7.37. It's a respiratory acidosis that is fully compensated. There's a clinical implication for that. Give you this, and then they will ask you, what would you do? That means you have to read this first, and then you decide what you need to do. You give the patient bicarb. So, number 8, we have what? 7. So we write our this thing, follow the protocol for to make things easier. It's just making you focus. This is greater than that. If you're greater than me, you are alkalotic. That's all. What do I expect in alkalotic? CO2 to go down and bicarb to go up. What did CO2 did? It went down a little bit, but this is still within normal. It's 35 to 40, so I'm not thinking about it. What did bicarb when? It went up. So that is good. So that is what is causing the problem. What is bicarb usually does is metabolic. So I have a metabolic problem. I got to fix it. I have to do, if it's metabolic, you go respiratory. If it's alkalotic, I do acidosis. So compensation means respiratory acidosis. What is respiratory? Respiratory acidosis, respiratory means CO2. What is acidosis? CO2 should go up. What is CO2 did? It did not do anything. It remained normal. Therefore, I have no compensation. So my answer is metabolic um, alkalosis, uncompensated. And this is the end of it. I hope you learned something out of it. Thank you for listening, and keep charging.